Hello, everyone. Today is Thursday, July 29th. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here at our downtown location on 251 North Bayou Street to give you an update of the impact of the COVID-19 epidemic on Mobile. Our daily report today shows 47,680 cases. 472 cases were reported yesterday. A total of 869 people have died. No new deaths were reported to us yesterday. The cumulative number of hospitalized stands at 6,313. 26 additional people were hospitalized yesterday, admitted to the hospital with COVID-19. The number of people in the hospital yesterday, as we predicted, jumped over 200. So yesterday, 211 people were hospitalized with COVID-19. If you remember back in December and January, I believe the largest number of people hospitalized on any given day was in the 260s. We are quickly getting to that space, and remember that the overwhelming majority of the cases and the hospitalizations are occurring in unvaccinated individuals. To share with you a little bit of information, something really important, I think the Alabama Department of Public Health has basically taken down their the previous dashboard that they used and replaced it. So really modernized, removed some things that maybe weren't important or they lost their value, and put some new things on there. So again, one of the big changes is to realign the risk indicator dashboard to make sure that it aligns with the way CDC is calculating risk. So the levels of community transmission is what CDC uses in many guidance documents, including K through 12 schools. So it's really important for us to do that. So you will see that most all of Alabama is in the high risk category. We have just a few counties that are still in the substantial risk, and if you look at that nationwide, the southeast is almost totally in the red or high risk category. They eliminated the total tested count, as this is not very meaningful anymore. The moving 7-day sum will be updated daily instead of weekly. And that's going to replace the chart used to have a 3-day moving average, a 7-day moving average, and a 14-day moving average on top of the sum of cases. So it will provide a 7-day moving sum of cases. Also changing some things in the number of cases and the way the percent positivity is displayed. And they have, I think on tab 2, an index of all of the tabs. As you know, the tabs are named 1 through 11. Sometimes hard to kind of click through there and see which one you need to get to. But on tab 2, if you'll just quickly go to tab 2, you can see the index so that you can navigate. I think the most important thing that is added that is brand new, most things are just slightly different, but there is a brand new tab 11 that provides the geographic distribution of COVID variants in Alabama in the last 4 weeks. So this is the first time that those data have been presented publicly. So please go to the ADPH dashboard and get the information that you need there. You will see for all districts, the Delta variant is the dominant variant detected in the last 4 weeks, with very few detections of other variants like the UK variant. So take a look at that new dashboard. We're really excited. We've been waiting on that for some time. I know they've put a lot of work into getting that ready for everyone. I get lots of questions about variant cases for Mobile and breakthrough cases. So now that the variant cases are displayed by district, the Mobile district or Mobile County will be listed there. The data are for the last 4 weeks. Since we began conducting sequencing, we've sequenced about 200 variant cases in Mobile. Early on, they were mostly UK, and now they're almost all Delta. Also, people ask me a lot about breakthrough cases. So these are people who were fully vaccinated but got COVID anyway. And again, we expect this to occur because the vaccines are 94 and 95% effective, which is great. It's an amazing vaccine, but there are still some people who will not get the full measure of immunity or won't be fully protected after that vaccine. So in Mobile, we've seen less than 200 vaccine breakthrough cases. This was data through July 20th, and only about 8-9% of those had been hospitalized. So we still are seeing the overwhelming majority, upwards of 90% of people who are hospitalized are not vaccinated. And then I also get asked quite a bit about reinfections. This number has been a little bit more elusive to obtain, but statewide, there have been nearly 5,000 reinfections detected. And remember, surveillance systems aren't perfect. So what we mostly do is look at the trends. Are things getting worse or are they getting better? And there is no denying that right now everything is moving in the wrong direction. Just a little bit, the Alabama Department of Public Health released yesterday a health alert network giving some more information about COVID-19 masking and the Delta variant. We've talked about the fact that the Centers for Disease Control has said that in areas like Mobile, where we have high transmission rates, that regardless of vaccine, if you're vaccinated or unvaccinated, you should wear a mask when you're around people that don't live with you. And the state health department issued a health alert network emphasizing the importance of that it makes up over 80% of the Delta variant, makes up over 80% of all COVID cases in the state of Alabama. We're seeing substantial high transmission with 60 counties in that high risk category. Just a couple of days ago, there were over 1,000 people hospitalized across Alabama, and the positive cases occurring about 2,000 a day. We've been seeing 500 a day, which means that that Mobile is, 20 to 25% of all the cases reported in the state of Alabama, which is just too bad, particularly since we have a very good vaccine. Remember that we have had more deaths reported to us in July than in June, and most of those are occurring in the unvaccinated, and they are, could be prevented with people getting the vaccine. So what do we know about the Delta variant? So it's different from earlier versions of the virus. It's much more contagious, easier to spread, and it comes with higher viral loads. So that means when it gets into your respiratory system, it replicates more quickly and gets to a high viral load faster than some of the other forms of COVID. So this means you will be infectious to others much sooner than you would have been with the parent strain. It also means that your onset of symptoms and feeling really sick may happen faster if you're not vaccinated. So, and again, there is growing evidence, and we know that asymptomatic people can infect others if they have COVID. So we expect that there is going to be asymptomatic spread in people who were fully vaccinated and got infected and didn't know it because they had a very mild illness. So again, another reason in this really high state of transmission to wear a mask, to physically distance, and layer those protections. See what has changed with the updated guidance. Again, everyone, including fully vaccinated persons, should wear a mask in all indoor settings to prevent the spread of Delta, to protect others. And we also recommend universal indoor masks for all teachers, staff, students, and visitors in the K through 12 setting, regardless of their vaccination status. You may have seen that Baldwin County Schools announced earlier today sort of a change in their posture, that they now are going to require facial coverings for everyone when in-person learning starts back in Baldwin County. It will be interesting to see if other school districts, um, join in to try to uh, have everyone sort of doing the same thing. So I'm sure that will continue. That story will continue to unfold. What can you do to reduce the spread of COVID-19, including the Delta variant? Get vaccinated, wear a mask, distance, stay at home if you're sick, wash your hands, all of those things. Again, we still are stuck at about 33% of Mobilians who are fully vaccinated. Yes, more people are seeking vaccination, but last week there were only about 4,200 people the whole week who got vaccinated in Mobile County. So we really need everyone to go. And just to remind you that, yes, the health department is providing free vaccine at two of our clinics and throughout the community, but there are still hundreds of other places in Mobile and Baldwin County that you can walk in and get a COVID vaccine. So please don't, it's at all the other locations, there's no charge. So you fill out some paperwork, get a free vaccine, wait 15 minutes, and go on with your shopping or your retail, or get your prescriptions filled. Let's see. Want to talk about monoclonal antibody treatment for non-hospitalized patients. So it's very important that providers remember that if you test someone for COVID, whether or not they have symptoms at that time, if they have underlying medical conditions that might cause them to, have some severe illness, should they, start developing symptoms, please consider referring them for monoclonal antibody treatment. I realize that some of the infusion centers are backing up. Their appointments are starting to back up. So you may have to wait 4, 5, 6 days to get an appointment, but better to go ahead and make that appointment when you have the opportunity to interact with that patient. So again, it's very important. So whether or not vaccinated, not vaccinated, history of COVID, not a history of COVID, anyone should be tested, and all persons who are positive and have mild or moderate symptoms not requiring hospitalization and are at high risk for complications from COVID-19 infection should be treated with COVID-19 monoclonal antibodies, again, to try to get them well and prevent them from having high risk complications that would require hospitalization, because our ICUs are full. The hospitals are adapting, but if we can keep people out of the hospital, that's absolutely what we need to be doing. All right, I have a very long list of questions here, and I will try to get to as many of them as I can. I'll start with the Facebook question. So someone asking, what happens if you want the vaccine but you don't have insurance? Like tourists from another country, can they get a vaccine? Yes, we will vaccinate anyone who is 12 years or older for COVID-19. It does not matter where they live or where they come from. We will vaccinate you. You do not need insurance. You really don't even need an ID card. Just remember that if you get Moderna or Pfizer, you will need a second dose. So think about that. If you live in another country and you're here and you want to get vaccinated, you may want to get vaccinated with the J&J vaccine, since that is a one and done vaccine. And we got some good news today on J&J. Many of the lots that we have, which were expiring in early August, the expiration date has been extended another 45 days. So they have been shown to be shelf stable for longer than expected. Let's see, I've already talked about the very low rate of vaccinated patients testing positive, and about the percent of cases in Mobile County that are unvaccinated. It's very low. Also, hospitalizations among unvaccinated is very low. So when I say low, I'm talking about 10% or less. right? 5% or less. Um, it's difficult to say precisely because our current um, surveillance system for detecting cases and investigating cases, the immunization data is not in that database. And in order to get immunization information on people, we would have to be able to interview them. With 500 cases coming in a day, I don't have enough investigators to interview them all. So what is being done at the state health department is they are taking the surveillance system for laboratory results and cross-referencing that with the immunization registry. So that is how we're getting some information. And again, not everybody who tests positive is in our database, and not everybody who gets a vaccine is in the vaccine registry. They may have gotten it elsewhere. So these are not precise numbers. You guys know I call it disaster math because we're in the middle of an unprecedented pandemic. We don't always have, perfect information. We never have perfect information. We're also getting information about the percentage of people hospitalized, vaccinated and unvaccinated, from hospitals, and it is less, right around 10% of the people hospitalized. It's about 8.9%, but it changes really quickly. Every day it changes. So again, a small proportion, a small number of people who are hospitalized are vaccinated. A small number of cases are vaccinated. Overwhelmingly, this wave is happening in unvaccinated people. Let's see. Is there a new test for the Delta variant? There are tests for the Delta variant. They're not necessarily new, and it's based on looking at the specific genetic makeup of the Delta variant, really targeting those areas of the genetic material that are different from the parent strain. Can a fully vaccinated person infect another fully vaccinated person from Delta? It's possible, but it would be sort of like a lightning strike. If you are fully vaccinated and unlucky enough to get COVID, and you transmit it to another fully vaccinated person who is unlucky enough to get COVID, those are two very rare events that would occur in tandem. We do hear of this happening in some families, right, where you have very intense interaction, where you have a lot of together time, where you have two parents that are vaccinated and perhaps your children are not old enough to be vaccinated, or maybe you had an adult child living in the house that chose not to be vaccinated. When Delta gets into that household setting, it will likely infect everyone. It's so contagious and it replicates so quickly and your viral loads get so high. And in other spaces like churches or classrooms where there's a little bit of spreading out, it still will run through very quickly, but there are more opportunities to distance and layer on those mitigation strategies that you can do in larger settings where people are only around each other for short periods of time. When you're in a household with mixed vaccination coverage, it's really hard to try to keep Delta from spreading to all of the people. I get this question a lot. How do we protect young children while they're in school, particularly the ones that are too young to get vaccinated? That's why the health department and the Centers for Disease Control are strongly recommending universal mask wearing for everyone, regardless of vaccination status. We also, strongly recommend anyone 12 and over get a vaccine. Teachers, visitors, contractors, students, staff, anyone 12 and over should get a vaccine. The more people that are in the school and vaccinated, the more likely you are to be able to interrupt transmission when COVID is jumping person to person to person. The Mobile County Health Department will not issue a mask mandate. We will not be issuing vaccination mandates. We know what works to stop COVID. This is our fourth wave, And we know that distancing and hand washing and staying at home and adherence to isolation and quarantine will slow the outbreak and bring it down to just a small number of cases. That's what we did following December and January. Going into February, we started to, to see that number of cases go down really fast. And when the vaccine came out, it just nearly dipped, nearly to zero in late May and June, because we had some good vaccination, older people getting vaccinated, underlying medical conditions getting vaccinated. Where we messed up is our younger populations failed to get vaccinated. And so as the Delta variant then showed up and started circulating in that younger crowd, that's what's led to what we have now, which is record numbers of cases reported every day. So we don't need a mandate necessarily. We need everyone to get vaccinated and to use the mitigation strategies, those layers of protection that have gotten us out of this very alarming outbreak before. Let's see. Someone asking to talk more about schools. So I think we've maybe run that into the ground. All right. I think that's probably enough for today. I know WPMI and Lanyap both had some questions that they wanted to answer. I may have to do those over email if I can get to it today, and if not, we'll roll those over and I'll try to get around to some of those questions. So thank you for your interest. Thanks for listening. If go out and talk to someone who hasn't been vaccinated to try to just coax them into it. I keep hearing this from younger people. Well, I just don't think I need it. I mean, that's a me response. It's all about me response. And it's so surprising to me to hear young people being so me-centric, right? This is a we time. This is an us. This is a community time. So even if it's all about you, think of it in a different way. Think about the we. Think about the us. Think about doing your part for your community, even if you don't think you're going to get COVID. That's my plea to the young folks out there today, particularly those people that are aged 18 to 49. Think more about we. Thank you. Talk to you guys tomorrow.